So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about the World Health Organization balance sheet. President Trump has declared he will halt U.S. funding to World Health Organization. How much does the World Health Organization get from the U.S. and other member states, including India? Where does it spend? What is its role in India's COVID-19 battle? After days of sniping off the World Health Organization over its handling of the COVID-19 pandemic, President Donald Trump on Wednesday announced that he would halt the funding the U.S. gives to the World Health Organization, which he said was mismanaging the spread. This comes when the global case load approaches 2 million, including over 1 lakh deaths. The U.S. has seen the most cases, over 6 lakh, and deaths over 26,000. India reached cautiously to Trump's announcement, avoiding official response and maintaining the country's focus now as containment and management of the outbreak. Where does World Health Organization get its funding from? It is funded by a large number of countries, philanthropic organizations, United Nations organization, etc. According to the information uploaded by the World Health Organization, voluntary donation from member states such as the U.S. contribute 35.41%, assessed contribution are 50.66%, philanthropic organizations count for 9.33%, Indian organizations contribute about 8.1%. The rest comes from borrowed sources. The U.S. contributes to almost 15% of the World Health Organization to funding and almost 31% of the member state donations, and the largest chunk in both cases. India contributes 1% of the member state donation. Countries decide how much they pay and may also choose not to. For the WHO, the loss of about 15% of its total funding is bound to have an impact on the world over. However, unless other countries do the same as the US, the move may not severely hamstring WHO operations. What does the WHO do with its funds? The WHO is involved in various programs. For example, in 2018 to 2019, 19.36%, about $1 billion, was spent on polio eradication, 8.77% on increasing access to the essential health and nutrition services, 7% on vaccine preventable disease, and about 4.36% on prevention and control of the outbreaks. Africa countries received $1.6 billion for WHO projects, and Southeast Asia, including India, received $375 million. India is a member state of the WHO Southeast and region. The Americas received $62.2 million for WHO projects. That is where most of the WHO funding comes from, and the least of it goes. How does WHO prioritize spending? The annual program of the work is passed by the WHO decision-making body. The World Health Assembly is represented by the delegates from all the member states and focusing on specific health agenda prepared by the executive board. The main functions of the assembly held annually in the Geneva are to determine WHO policies, appoint to the Director General, supervise financial policy, and review and approve the proposed program budget. The decision on which country gets how much depends on the situation in the countries. The WHO's 13th General Program of the Work lays down unequal development in different countries in the promotion of health and control of diseases, especially communicable diseases, is a common danger. How involved is WHO in India? India became a party of the WHO Constitution on January 12, 1948. The first session of the WHO Regional Committee for the Southeast Asia was held October 4 to 5, 1948 in the office of the India's Health Minister and inaugurated by the Prime Minister Jawaharlal Nehru. The WHO India Country Cooperation Strategy 2019 to 2023 has been developed jointly by the Health Ministry and the WHO India Country Office. According to WHO statement, this CCS not only builds upon the work the WHO has been supporting out in the last several years, but also expands to the address complex of the challenges such as the prevention of the NCDC, the control of an antimicrobial resistance, the reduction of air pollution, and prevention of the treatment of the medical illness. WHO will further expand its collaboration with a broader set of government sectors and other stakeholders beyond health under the overall guidance of the Ministry of Health and Family Welfare, as well as continue to work collaboratively with other United Nations agencies and international partners. The CCS strategic priorities are to accelerate progress on the universal health coverage, promote health and wellness by addressing the determinants of the health, better protect the population against the health emergencies, and enhance India's global leadership in health. On the ground, WHO has been a key partner in the immunization program tackling TB and neglected diseases such as leprosy and Kala's nutrition programs across states. The credit for the success of a program is always of the country. The WHO plays a supportive role. That is why a WHO country office is rarely even critical of a government, even when it is chosen policy different from what WHO advises. A case in point is India's reluctance to test broadly for COVID-19, even though WHO emphasized its importance. How have WHO and India worked together in the COVID-19 pandemic? According to Dr. Hank Beckham, WHO country representative in India, India is not at a crucial juncture in its fight against COVID-19. It is a movement that must be to fully sized. WHO has been working closely with the Ministry of Health and the various state governments on preparedness and responsive measures for the COVID-19, including surveillance and contact tracing, laboratory and research protocols, risk communication, hospital preparedness, training on infection prevention and control, and cluster containment plan. WHO stands together in solidarity with the government in its firm resolve to overcome this unprecedented challenge. India has, however, largely been in sound strategy from its reluctance to test to the early travel restriction to and from the China and then the lockdown. While India imposed a law on when cases were just 341 on March 22, starting with 75 districts, its resistance to mass testing is akin to the US strategy. India has also taken a call on the universal use of the mask when the WHO maintained that masks protect others rather than the wearer and need not to be mandatory. What is the basis of the criticism the WHO faces from various countries? While most countries closed down air travel at the first stage, the WHO for a long time took a stand against travel and trade restrictions on China. On January 30, WHO Director General Dr. Tedros Adhanom Ghebreyesus said the WHO opposed such an idea. The same day, International Health Regulation 2005 Emergency Committee urged countries to be prepared, but the committee doesn't recommend any travel or trade restriction based on the current information available. According to senior officials in the National Center for Disease Control, in January, when the cases were piling up in China, there was a meeting in Delhi in which the WHO officials brushed aside government concerns, saying there is no human-to-human transmission when cases kept going up and moved out of Wuhan. We ask what's happening. Either there are more sources than just one fat market in one province, or there is clearly human-to-human transmission happening. So if you like the channel, so kindly subscribe to it.